Every morning, your body gives you a report card, a complete, detailed, medically significant assessment of everything that happened inside your body while you were sleeping, delivered through seven specific signs that appear within the first 30 minutes of waking. Most seniors look at these signs every single morning. They see them, they feel them, and they dismiss every single one as normal aging. They are not normal aging. After 65, your body does not have the luxury of sending dramatic, obvious warning signals the way it did at 40. It communicates quietly through morning signs that are easy to miss if you do not know what to look for. I have been practicing internal medicine and geriatric care for over 23 years. And the morning signs I am about to show you have been present, sometimes for months or years, in patients who later received serious diagnoses that could have been caught earlier if someone had just known what these signs meant. In this video, I will walk you through seven specific morning signs that seniors should never ignore, what each one looks like, what it means medically, and exactly what to do when you notice it. Pay attention. Your body has been trying to tell you something every single morning. Today, you learn to listen. Tell me in the comments, which of these seven signs do you experience regularly? Type your answer below. I read every comment. Before the seven signs, you need to understand why morning specifically is the most diagnostically valuable time of day for your body. During sleep, your body enters its deepest repair and assessment mode. Hormones are released, cellular damage is addressed, inflammatory processes either resolve or intensify, and your organs, heart, kidneys, liver, lungs, brain, operate without the demands of physical activity or food processing. By morning, the results of that overnight biological activity are visible in how you feel, how you look, and what your body is doing in those first 30 minutes. Morning is when blood pressure is naturally at its most revealing, showing its true baseline without the variables of daytime activity. Morning is when kidney function is most measurable through the concentrated first urine of the day. Morning is when inflammation is most detectable through joint stiffness that has had hours to accumulate. And morning is when heart function is most vulnerable, the period of highest cardiovascular risk in every 24-hour period. A study published in the Journal of the American Medical Association found that the majority of heart attacks, strokes, and sudden cardiac deaths occur between 6 a.m. and noon, the morning hours when the body transitions from sleep to waking activity. Understanding and monitoring your morning signs is therefore not just health awareness, it is cardiac protection. These seven signs, every morning, know what they mean. Morning sign one, swollen face or puffy eyes when you wake up. Look in the mirror first thing tomorrow morning before you do anything else. Is your face noticeably puffier than it was when you went to sleep? Are the areas beneath your eyes swollen more than the occasional mild puffiness that most people experience? Mild transient puffiness that resolves within 30 minutes of waking can be positional, caused by fluid redistribution during sleep. This is generally not concerning. But persistent facial swelling, puffiness that remains for an hour or more after waking, that has been progressively worsening over weeks, or that is accompanied by swelling elsewhere in your body, is a specific warning sign of kidney dysfunction in adults over 65. Here's the mechanism. Healthy kidneys filter excess fluid and protein from your blood continuously. When kidney function declines, two things happen simultaneously. First, fluid is not efficiently removed and accumulates in body tissues. Second, albumin, the protein that keeps fluid inside blood vessels, he leaks into urine because damaged kidney filters cannot retain it. With less albumin in the blood, fluid leaks more readily into surrounding tissues. The face, particularly the area around the eyes where the skin is thinnest, is one of the first places this fluid accumulation becomes visible. A study published in the American Journal of Kidney Diseases found that facial and periorbital edema, swelling around the eyes, was one of the earliest visible signs of nephrotic syndrome, a form of kidney disease appearing before any blood test abnormality in a significant proportion of patients. If your face is regularly puffy upon waking, and especially if this is accompanied by foamy urine, reduced urine output, or fatigue, request a kidney function panel including eGFR, creatinine, and urine albumin to creatinine ratio from your physician this week. Morning sign 2, severe stiffness that takes more than 30 minutes to improve. How long does it take your joints, particularly your hands, knees, and hips, to loosen up after you wake up? Brief morning stiffness lasting 5 to 15 minutes is common in older adults and reflects the normal accumulation of synovial fluid stagnation during hours of sleep inactivity. As I described in my stretching video, moving your joints pumps fresh synovial fluid through them and reduces this normal stiffness. But morning stiffness that lasts more than 30 minutes, particularly stiffness that is severe, that affects multiple joints symmetrically, and that has been progressively worsening, is a clinical warning sign of inflammatory joint disease that requires medical evaluation. Rheumatoid arthritis, an autoimmune condition where the immune system attacks joint tissue, classically presents with morning stiffness lasting more than 1 hour that is significantly worse in multiple joints simultaneously. Unlike osteoarthritis, where stiffness typically improves with movement within minutes, inflammatory arthritis produces stiffness that persists despite movement and is accompanied by warmth, swelling, and tenderness in affected joints. Why does this matter for cardiovascular health? Because rheumatoid arthritis and other systemic inflammatory conditions are now recognized as significant independent cardiovascular risk factors. The same inflammatory processes attacking joint tissue also attack arterial walls, accelerating atherosclerosis and increasing heart attack and stroke risk by up to 50% in affected adults. A study published in the Annals of the Rheumatic Diseases found that adults with rheumatoid arthritis had cardiovascular risk profiles equivalent to adults with type 2 diabetes, a comparison that illustrates how seriously the cardiovascular implications of inflammatory joint disease must be taken. If your morning joint stiffness consistently lasts more than 30 minutes, mention this specifically to your physician and request inflammatory markers including CRP, ESR, and rheumatoid factor in your blood work. Morning sign. 3. Waking up already exhausted. Do you wake up after a full night of sleep feeling as tired as when you went to bed? Does your exhaustion seem to have nothing to do with how much or how little you slept? As I discussed in my sleep video, waking exhausted despite adequate sleep hours is not normal aging. It is a symptom. And after 65, it has three specific causes that each carry distinct medical significance. The first and most important cause to rule out is sleep apnea, a condition where breathing repeatedly stops during sleep, preventing the deep restorative sleep stages where your body repairs itself, consolidates memory, and clears toxic proteins from the brain. Sleep apnea affects approximately 40% of adults over 65, and the majority are undiagnosed. Untreated sleep apnea increases the risk of hypertension, heart failure, stroke, and cognitive decline significantly. The diagnostic clue for sleep apnea beyond morning exhaustion is this. Does your partner report that you snore loudly, gasp during sleep, or stop breathing momentarily? If yes, request a sleep study from your physician immediately. The second cause is hypothyroidism, underactive thyroid. Your thyroid gland produces hormones that regulate your body's metabolic rate, the speed at which every cell generates energy. When the thyroid is underactive, metabolism slows, energy production falls, and profound fatigue, present upon waking and persisting throughout the day, regardless of sleep, is one of the most consistent symptoms. Hypothyroidism affects approximately 20% of adults over 65 and is significantly more common in women. A simple TSH blood test diagnoses it, and it is completely treatable. The third cause is heart failure, specifically the reduced cardiac output that prevents adequate oxygen delivery to your tissues, including your brain. Morning exhaustion from cardiac causes is typically accompanied by at least one of the other morning signs I am describing: ankle swelling, breathlessness, or irregular heartbeat. Morning exhaustion that has persisted for more than 2 weeks and does not improve with adequate sleep. Request TSH thyroid test, sleep apnea screening, and cardiac function assessment. Morning sign 4, morning headache that disappears during the day. Do you regularly wake up with a headache, one that is present when you open your eyes, but gradually fades over the first hour or two after waking? This specific pattern, morning headache that resolves through the day, is one of the most diagnostically significant morning signs in adults over 65. And it has two primary causes, both of which require medical attention. The first and most common cause is uncontrolled overnight hypertension. Blood pressure follows a natural daily rhythm, typically lowest during sleep and rising sharply in the early morning hours. In seniors with poorly controlled hypertension, this morning surge can produce significant pressure elevation that manifests as a throbbing headache at the back of the head or across the forehead. As activity begins, blood pressure distribution normalizes and the headache fades. This pattern is significant because overnight blood pressure elevation, even when daytime readings appear controlled, is associated with significantly higher rates of stroke and cardiac events. Many seniors whose daytime blood pressure appears manageable are experiencing dangerous pressure elevations overnight that only a morning headache is signaling. The second cause is sleep apnea. Every time breathing stops during sleep, carbon dioxide accumulates in the blood. Elevated CO2 causes cerebral blood vessels to dilate, producing a characteristic diffuse morning headache that resolves as breathing normalizes during waking hours. Morning headache is present in over 50% of adults with significant sleep apnea, making it one of the most consistent daytime indicators of nighttime breathing problems. If you regularly wake with a headache, particularly one at the back of your head, take your blood pressure immediately upon waking before any activity or medication. If it consistently reads above 140 over 90 in those first morning minutes, discuss overnight blood pressure monitoring with your physician. Morning sign 5. Irregular or racing heartbeat upon waking. Place two fingers on the inside of your wrist right now, below your thumb. Feel your pulse for 30 seconds. Is it regular, a steady, consistent rhythm, or does it feel irregular, skipping beats, adding extra beats, or racing without any physical cause? Checking your pulse every morning takes 30 seconds, and it is one of the most powerful cardiac monitoring tools available to seniors without any medical equipment. Morning is the highest risk period for cardiac arrhythmias, particularly atrial fibrillation. During the transition from sleep to waking, the autonomic nervous system shifts from parasympathetic dominance, which slows the heart, to sympathetic activation, which accelerates it. This transition, combined with the natural morning surge in blood pressure and cortisol, creates the conditions most likely to trigger irregular heart rhythms. Atrial fibrillation, the most common cardiac arrhythmia in adults over 65, affecting approximately 9% of this age group, produces an irregularly irregular pulse, not just occasional skipped beats, but a completely chaotic rhythm where no two beats are evenly spaced. If you feel this pattern in your morning pulse check, call your physician the same day for an ECG. A resting pulse consistently above 100 beats per minute in the morning, see before any activity or stress, is called tachycardia and warrants evaluation for thyroid disease, anemia, heart failure, or infection. A resting pulse below 50 beats per minute with associated dizziness or fatigue is called bradycardia and may indicate heart conduction problems or medication side effects that require adjustment. Make the 30-second morning pulse check a non negotiable daily habit. Write your reading down, track it over time. Any new irregularity, call your physician. Morning sign 6. Urgent or frequent. Need to urinate immediately upon waking. Is the first thing your body demands every morning an urgent trip to the bathroom? And does this urgency feel more pressing than it used to, or harder to delay, more uncomfortable if not immediately addressed? Morning urinary urgency in seniors over 65 exists on a spectrum from mildly inconvenient to medically significant, depending on its severity, its pattern, and what accompanies it. Mild urgency upon waking, needing to urinate within the first few minutes of getting up, is common and generally reflects the normal accumulation of overnight urine production. This alone is not alarming, but severe urgency that makes it difficult to reach the bathroom safely, urgency accompanied by any leakage, urgency that has been progressively worsening over months, or urgency combined with any of the following symptoms warrants evaluation. Burning or pain with urination alongside urgency suggests a urinary tract infection. As I mentioned in my kidney video, UT is in seniors frequently present without the burning sensation younger adults experience. The urgency itself may be the primary symptom. Untreated UT is in seniors can rapidly progress to kidney infection and sepsis. Urgency combined with increased nighttime urination, increased thirst, and unexplained fatigue suggests uncontrolled or undiagnosed diabetes. Elevated blood sugar forces the kidneys to excrete glucose in urine, producing increased urine volume that stresses the bladder and creates urgency. And in men specifically, Morning urgency combined with a weak urinary stream, difficulty starting urination, or a sensation of incomplete emptying suggests prostate enlargement, benign prostatic hyperplasia, which affects over 50% of men over 65 and can, if untreated, cause urinary retention and kidney damage. Track your morning urinary urgency. If it is worsening, note when and how significantly. Bring this observation specifically to your physician. Morning sign 7, shortness of breath when you first stand up. The final morning sign is one that is easy to dismiss as simple deconditioning, but that can represent one of the most serious cardiovascular warnings available to seniors without any medical testing. Does standing up from bed in the morning leave you noticeably breathless? Breathless that seems disproportionate to the minimal effort of simply rising from a horizontal to a vertical position? In a healthy cardiovascular system, the transition from lying to standing is managed seamlessly. Heart rate increases slightly, blood vessels in the legs constrict, blood is redistributed efficiently, and within seconds, circulation has adjusted to the new position. When the heart muscle is weakened, as in heart failure, or when significant coronary artery disease reduces the heart's ability to increase its output on demand, standing up creates a sudden demand for increased cardiac output that the struggling heart cannot meet efficiently. The result is transient breathlessness, usually lasting 30 to 60 seconds, that resolves as the heart partially compensates. This symptom is particularly significant because it occurs at the lowest possible level of physical demand. If simply standing up from bed causes breathlessness, the heart's reserve capacity is severely compromised. A study from the European Journal of Heart Failure found that breathlessness on minimal exertion, including positional changes, was one of the strongest predictors of significant left ventricular dysfunction in adults over 65 presenting to primary care. If you experience breathlessness upon standing in the morning, particularly if it has been worsening gradually or is accompanied by ankle swelling, morning fatigue, or irregular heartbeat, request an urgent cardiac evaluation, including BNP blood test and echocardiogram. Now, let me give you a simple 2-minute morning health check that turns these 7 signs into a daily monitoring system. Every morning, before you get out of bed and before any activity, do this: 30 seconds, pulse check, 2 fingers on your inner wrist. Count for 30 seconds, multiply by 2. Note the rate and whether the rhythm feels regular. Write it down. 30 seconds, breathlessness check, sit up slowly, then stand. Note whether standing causes breathlessness disproportionate to the effort. 30 seconds. Face check. Look in the mirror. Note any facial or eye puffiness. Note your lip color. Pink is healthy. Blue or purple requires emergency evaluation. 30 seconds. Joint check. Move your fingers, wrists, and knees. Note how stiff they feel and how quickly the stiffness resolves. These 4 checks take 2 minutes. They cover 6 of the 7 morning signs. The 7th, urinary urgency, will make itself known without any deliberate checking. Track what you find, even informally. A pattern that emerges over days and weeks is far more valuable to your physician than a single observation made during a brief appointment. 5 steps, starting tomorrow morning. Action step 1. Tomorrow morning, perform the 2-minute morning health check I just described. Pulse, breathlessness on standing, face and lip color, joint stiffness timing. Write down what you find. Action step 2. If you recognize 2 or more of the 7 signs I described, call your physician this week for an appointment. Bring your written observations. Be specific about what you noticed, when it started, and whether it has been worsening. Action step 3. Request these specific tests at your next physician appointment: TSH for thyroid, EGFR and urine albumin for kidney function, BNP for heart strain, CRP for inflammation. These 4 tests together give a comprehensive picture of the conditions most likely to produce the morning signs I described. Action step 4. If you experience morning breathlessness on standing combined with ankle swelling and fatigue, do not wait for a routine appointment. Call your physician today. This combination is a cardiac emergency warning that requires urgent evaluation. Action step 5. Share this video with every senior in your life, because right now they are waking up every morning with one or more of these signs, dismissing each one individually when the pattern together is telling an important story that their doctor needs to hear. Every morning, your body hands you a report: 7 signs, delivered quietly, consistently, faithfully, every single day. A puffy face, stiff joints that take too long to loosen, exhaustion that sleep cannot fix, a morning headache that fades by noon, an irregular pulse under your fingertips, an urgency that will not wait, a breathlessness that standing up should never cause. None of these is dramatic. None of them announces itself as an emergency. And that is exactly why they are so consistently missed until the condition behind them has progressed far beyond where early intervention could have made the greatest difference. You now know what these signs mean. You now know the 2 minute morning check that puts this knowledge into daily practice. And you now know that these signs are not the price of getting older. They are invitations to pay attention, to seek answers, and to give your body the response it deserves when it speaks. Subscribe to this channel for more senior specific, clinically grounded health information every week. Hit the like button if this changed how you will approach tomorrow morning. Leave a comment. Which of these 7 signs will you be checking for first? Thank you for watching. Your body speaks every morning. Make sure you are listening.